Hi, I'm Dr. Woeller. A phenomena that I've seen with a number of kids in the autism spectrum, and some kids who aren't necessarily classically diagnosed with autism, but who have the characteristics of something called Pandas, which is a streptococcal infection, or it's a condition in the body that is triggered by a streptococcal infection, specifically group A beta hemolytic strep, where individuals develop obsessive compulsive behavior, sometimes tics, behavioral issues, weird and odd, movements of the head or the eyes or side glancing, different manifestations like that. Usually comes about, after an infection, sometimes a sore throat, can be a marked change in their behavior, social anxiety, anxiety in general, and mentioned before, very, very in severe forms, obsessive compulsive disorder. Now, there are certain individuals in the autism spectrum who have this characteristic, but there are also other people who develop obsessive compulsive behavior and tics, etc., who also have Pandas who are not autistic. One of the things that is interesting is in many of the supplements that people take, specifically probiotics, there is a specific bacteria called Streptococcus thermophilus. Now, this is a natural bacteria and is essentially listed as a beneficial bacteria for the digestive system and for our overall health. You also find it in some yogurt products as well. Now, it's reported that Streptococcus thermophilus is entirely different than group A beta hemolytic strep as far as its protein structure, etc., and therefore should not be a contributing problem to the obsessive compulsive problems or the other manifestations of Pandas. The problem is clinically, I've not always seen that to be true, which basically means that in many kids that I've seen, whether they're on the spectrum or not, who have this problem, just don't seem to react very well to probiotics that have Streptococcus thermophilus. So the reason I'm putting this video out here is just to inform you that if you have a suspicion that your child has Pandas or is likely a problem, check their probiotics. See if the probiotics that they're taking have Streptococcus thermophilus. If it is, consider changing it out to a different probiotic. It doesn't always fit, but oftentimes it does. I had a situation a couple of years ago where a patient and a child actually who had Pandas was successfully treated for it, was essentially in remission, started a group of new supplements, and all of a sudden started coming down with those Pandas conditions again, anxiety, tics, and some obsessive behavior. And so we went through a list of supplements and found out that there was a new probiotic that had been started, and the mom didn't realize that the Streptococcus thermophilus was an issue until we recognized that that was likely the contributing factor. Just that, stopping that one supplement alone, his Pandas symptoms, his OCD, his anxiety disappeared. So I've seen that happen now, with other kids and other people as well. And so it's one of the things that I look at clinically is if Streptococcus thermophilus is being used in a supplement, that's one thing I look to remove. So just a little FYI, just wanted you to be aware of that. Okay? Thanks.